evening. Today's agenda is coming to you live from the Gangaram Hospital, and the reason that we are coming live from here is because this hospital has become the center of the crisis of chikungunya and dengue. In fact, some breaking news coming in as Dr. Rana, who is the head of Gangaram Hospital, is telling us that till now we've known 4 deaths. Dr. Rana has told us that in just the last 1 hour, we've lost another patient. So 5 people have died here in the capital because of chikungunya. The deaths started happening yesterday morning. 5 deaths have occurred already. We'll be speaking to the doctors over here. We've got a large panel of doctors from Gangaram Hospital, from Apollo, from All India Institute of Medical Sciences, and we have some families over here as well whose wards are admitted at the hospital behind me. The ICU is just behind me, and people are really worried. And instead of tackling this crisis, how are the administrators dealing with it? Just take a look at the blame game and the politics that's been taking place. Take a look.
कॉर्पोरेशन सफाई नहीं कर रही है और जानबूझ के ऐसा लगता है दिल्ली के अंदर महामारी फैलाना चाहते हैं। उन लोगों से मैं कहना चाहूंगा कि अगर डेंगू का मच्छर काटेगा तो उनको भी काटेगा। ये दिल्ली के अंदर दिल्ली के जितने भी लोग हैं उसके साथ ये बदला क्यों लेना चाहते हैं, समझ से बाहर है। देखिए, पहली बात तो मैं आपसे रिक्वेस्ट करना चाहूंगा, पैनिक बिल्कुल ना फैलाएं। सबसे बड़ा ये मीडिया का क्रिएटेड पैनिक है और मीडिया को कहते हैं सुपारी दी जाती है कि आप उठा के इसको पैनिक बनाइएगा।
संवेदनशील चुनी हुई सरकार को गंभीर होना चाहिए और आरोप प्रत्यारोप में नहीं फंसना चाहिए। समय है कि हम दिल्ली की जनता की सेवा करें। केंद्र सरकार की ओर से पूरी सपोर्ट हमारी है, जो सपोर्ट चाहिए होगा वो हम देंगे।
So it's your responsibility, and if whoever you may have to go to take their help in prevention, that has to be done. For instance, all the hospitals are with them. How can you blame them? Everything is done collectively. When you're in governance, you talk with each other.
एलजी साहब कहाँ पर हैं, कहाँ गए हैं और क्या करने के लिए गए हैं? दिल्ली के 3 मेयर हैं नगर निगम के, और नगर निगम की जिम्मेदारी थी कि मच्छरों की जनसंख्या ना बढ़े। तीनों के तीनों मेयर कहाँ पर हैं और क्या कर रहे हैं? इस बार मच्छरों को मारने के लिए दवा का छिड़काव नहीं हुआ दिल्ली में।
You cannot spend 10 rupees. Most of your ministers today are in foreign destination or a destination other than Delhi. Whose money is it that they are spending? You have to answer these pertinent questions.
So some breaking news coming in. We've just been told by the Gangaram doctors that a 5th person has died in Delhi, and he was 70 plus, also from Delhi. Remember, Aam Aadmi Party has said that some of the people, the deaths can't be attributed to the conditions here because some of the people were 2 of the people, one was from Aligarh, one was from Ghaziabad. Now the health minister has also had a press conference in which he said that he believes, and the AIMS doctors have told him, that chikungunya can't claim or can't be fatal, can't cause deaths. Dr. Rana, in last 1 hour, you've said that the 5th patient has died in your hospital. Now, what would you say to the health minister who says chikungunya can't kill?
We also are aware that probably chikungunya is not causing death. That is what we haven't taught. But what I want to say that I cannot really say establish relationship between disease and death, But all these patients presented with a high-grade fever and all symptoms of chikungunya, and they were strongly positive for chikungunya done by PCR method, But we are calling for since 1st September, In our hospital, we are doing now all tests for such patient by PCR, and PCR is showing a lot of almost 60% patients, suspected patients, they are positive for this chikungunya. While we were doing the previous test by IGM only, then I can just say in last 1 month, test done by IGM on 355 patients that were reported nil in our hospital.
Okay. Now before we have Atishi Marlena from AAP, we have RP Singh from BJP. Before we speak to all of them, and of course the doctors are here to clear up the thing, I think the most worrying is for everybody watching at home, people who have fever, people are scared, who are getting ill. Now, we have some people over here whose wards are admitted in the hospital. Sir, aapki wife hai? Yes. She is in hospital.
She's in hospital.
And tell us the problems that you've encountered because of a chikungunya. Was screening very difficult? Was diagnosing it very difficult?
No, it was diagnosed on a 9th of this month. And she was admitted yesterday night at 10 o'clock. We remained in the emergency. There is no bed, so ultimately we got a bed in the medicine department under Dr. Atul Kakkar treatment. She has the problem of protein level has jumped up immediately.
Okay.
Due to this.
And so when you hear Aam Aadmi Party, BJP fighting with each other, how do you feel?
They are useless people. They are only vote bank, that's all. They are not bothered about the people. They are not bothered about the general public.
There's another person over here who has... okay, well, he's just going to come...
False statement.
They're making false
False
statements.
statement, yes.
Atishi Marlena, you just heard someone whose wife is admitted, and the people are very upset about the political statements that they're seeing over there, especially the denial that chikungunya can be fatal. How do you respond to all these concerned people?
First of all, I absolutely do understand there is a very worrying health situation in Delhi, and we on behalf of the Delhi government have been trying to provide as many facilities as possible in Delhi government hospitals, increasing the number of beds, providing free testing for dengue, for chikungunya, and these facilities are being provided on an everyday basis in Delhi government hospitals, and we are ramping up facilities from this moment onwards. However, the unfortunate state of affairs does exist in Delhi. You do have the fact that one government, which is the MCD, is responsible for public health, for preventive health, and you have another government, which is the Delhi government, responsible for curative health. While we can take responsibility for ensuring that curative health measures are ensured, the point of the fact of the matter is that dengue, chikungunya, malaria is caused by mosquitoes, and you do need to clear the garbage and you need to do fogging in the city. So my request goes out to the MCD, my request goes out to all the officials, all the mayors, that this is something
and about dengue has been existing for a few days now. I just wanted to, sorry to interrupt you, I just wanted to ask you that the scare has been on for a few days. A lot of people have reported the growing incidents, and of course you've been in the establishment, you would know that much more. Do you think in such a circumstance it was wise, and it looked like the government didn't care, with the health minister away in Goa looking after the prospects, political prospects of another state, instead of tackling things over here? And nobody was here today.
First of all,
Sir?
First of all, let me tell you that
in Punjab.
First of all, the health minister, two things. First of all, the Chief Minister is out of Delhi for a health matter himself. Number two, the Health Minister was away for only 2 days. However, for the past couple of months, arrangements, he was out only for 2 days. I'm just pointing that out. The Health Ministry has been ramping up all the facilities in Delhi government hospitals. If you were to go into any Delhi government hospital, you will see separate wards for chikungunya and dengue patients. You will see facilities for testing. Even now, we are looking to increase the number of beds. We have opened 262 clinics. So my request to all of you is that I think we all need to come together. Would request the media also to ensure that no situation of panic gets created in Delhi, because I think that if people panic in this situation, then the pressure on our hospitals would increase even further. And this is exactly what happened last year, that 60% of the people who got admitted for dengue actually did not need to be admitted, but reached there in a panic situation. So I think the message should, everyone should be that please, if you get ill, go to your physician, but do not get in a situation of panic.
Dr. Bedi, you blame the government. You feel that there's been some kind of mishandling. You heard what the spokesperson said just now about all the measures that they've taken. How would do you still disagree?
I think Virchow, who's considered the father of modern community medicine, about a century and a half said that socioeconomic problems are the root cause of public health. Public health cannot be handled at the health issue. Now, I think post-independence India, we have always outsourced our health thinking to either international NGOs or UN agencies, and they have their own priorities. For example, for 6 months we got a headache listening to Zika virus, and we've not been warned against chikungunya and dengue. And and once outbreak occurs, the social conditions don't. Once the point is the infrastructure was systematically messed up for decades, and now. For example, another thing I want to add, it may not be fatal in able adults, but chikungunya is generally a South India virus. It's new for the North Indians. So we do not have inherently very good immunity to it. But it is nearly fatal for the fetus. So pregnant women have to be extremely careful in this.
So major warning there for
all
people,
pregnant women, yes.
Pregnant women,
Because,
but we are seeing a lot of people who are older who are affected.
It's an RNA virus which gets into the fetus in no time, and it is an overwhelming virus in the fetus.
Okay, so before we get into the specifics, and I know lots of people have questions, we have a lot of families over here. RP Singh, I wanted to tell you that the BJP immediately, attacked the government and said that why aren't there any ministers here? You can't blame the LG. However, they have pointed out another thing, that the part of the cleaning process is the civic authorities, and the civic authorities in Delhi is handled by the BJP.
Now coming back to the issue where you started from, that who all are missing? The deputy CM is away to Finland. CM is away to Bangalore.
I asked them that, but I'm saying there are three mayors also missing.
No, they're not missing. I'll tell you what they're doing. The health minister is away to Goa campaigning, the other minister is away to Raipur, and another minister is away to Hajj. So out of these 7 ministers, 6 are missing. So who's going to take charge of Delhi?
We'll raise that, but I'm asking you another question.
I'm coming to that. For person, what is the priority? Election, it's nothing that which is now. The news happening. So Goa is a priority or Delhi is a priority? And coming to that MCD, there are 12 vans of MCD which are going from each cluster. I'm saying JJ clusters for that reason, because there are more reasons there. And giving free tests and giving free medicines also. But because, no, give me a minute. Now I'm making a request. Now positive suggestion here. I'm requesting Delhi government, please allow that test to be free for Delhiite people. People who's making 10,000 rupees a month can't afford a test of 1,600 rupees or 4,000 rupees. Please give that test free to Delhi for everyone, not only in government hospital. Even if someone go to a private hospital, give me a minute, ma'am. Also, and let me give you an example. Last year, Maharashtra government last year, every patient who was suffered from dengue went to any hospital, including Ganga Ram, was given a treatment free for the hospital.
I want to ask, your aunt went through this, right? She's just recovering. Did she have to pay for testing, or was it free? Did she go to a private clinic?
No, she went to AIIMS, so there it was free. And her father, even he suffered after that. He's in the ICU because of chikungunya. It triggered some sort of kidney problem and some sort of neurological problem. He's still in the ICU in the last 4 years.
Dr. Dang, most of the people, they come to the laboratory first. What kind of, are you seeing? AAP tells us, look, it's nothing to, it's the media which is creating the panic. As someone who's been there, who's seen it through the years, who do you think is responsible here, and should everyone be worried, or are we actually making too much of something which is routine for this time of the year?
It's a combination of both. Since the last 10 years, every year I am on this forum, and there's panic created, more panic than what it should be. But on the other hand, this disease actually should not be there at all. Why? You said the government is prepared. You say the tests are being done free in government hospitals. I would just like to ask one question. Were we prepared to start doing the real-time PCR before the monsoons came? No, not at all. As Dr. Rana rightly said, that Gangaram, Max, lots of hospitals and labs are doing the real-time PCR. But are the government hospitals, or were the government hospitals till about a month back equipped well enough to diagnose the disease? No. They were doing either by the ELISA method or looking for the IgM antibodies, which become positive much later in the disease. Why was the RT-PCR not introduced much earlier, when we anticipated and when we knew that we can have an onslaught of any of these viruses soon enough?